Hi everyone, thanks for connecting. Welcome to another webinar on unified thinking on COVID-19. The purpose is to integrate our thinking on COVID-19 as it continues to disrupt and end lives around the world. The impact of the novel coronavirus is complex and multidimensional, as you know. We'll discuss key components of our conceptual framework and consider what the world may look like after COVID-19. The purpose for the conversation today is to explore in a little greater detail the impact of COVID-19 on rare disease patients and rare disease organizations in particular. As always, it's a pleasure to introduce Kelly du Plessis, CEO of Rare Diseases South Africa. Kelly, thanks so much for joining us today.
Thanks so much for having me.
You're welcome. Kelly du Plessis is currently wife and also mother of 2 children and CEO and founder of Rare Diseases South Africa. Rare Diseases SA was born out of the necessity when her oldest child was diagnosed with Pompe disease at 11 months old. Pompe disease is a rare neuromuscular disorder which is fatal if left untreated. In 6 years, Kelly has taken rare diseases policy and patient advocacy to new heights in South Africa and has presented at various national and international conferences to raise awareness and create a new narrative in terms of treatment and access for rare patients. Kelly was awarded the African Leadership Award for Healthcare in December 2016, awarded in Mauritius, with other recent achievements including the successful launch of RareX, the first rare disease conference in Africa, founding Africa-Rare.org, an African Alliance for Rare Diseases, as well as the implementation of International Rare Disease Day in South Africa, which was a public awareness campaign reaching over 17 million South Africans in 2014. By way of an update, where we at today on COVID-19, so total global confirmed cases, 3.6 million. That is led by the United States at 1.2 million and approximately 220,000 in Spain. Total reported deaths just shy of 260,000. Within the context of South Africa, confirmed cases based on Johns Hopkins University data that we have available here. Confirmed cases 7,572 and deaths 148. The purpose, as I mentioned today, is to explore in a little greater detail the impact on patients and patient organizations with rare diseases, both individually and also from a civil society perspective. So it's these 2 components over here. Kelly, from your perspective, how is COVID-19 currently impacting patients with rare diseases and the organization that you started and that you run?
So I think, Joe, first and foremost, the whole concept of self-isolation, I think, is not very novel to a rare disease patient. I think we've spent a large portion of our lives, surely after diagnosis, knowing that you're at a higher risk. Flu season, this is a regular occurrence for us. We know what it's like to distance yourself. We know what it's like to avoid being in contact with sick people. So I think we almost have been lucky in that sense that this isn't a complete mind shift change.
Right.
I think one positive has been that obviously now that the rest of the population has had to do it too, there's a firmer understanding as to why it's so critical for these patients to have the necessary support in regards to infection control, etc. So I think that that's been a very good thing. One of the downsides is obviously from an economic perspective, which I think is going to be something that is evident around the world, not only for rare disease patients, is keeping your medical aid cover. I think that that's come up as a big concern. In South Africa, only 16% of the population has access to medical aid cover.
Yeah.
So that's private insurance. But the 16% that has access to that private insurance is not necessarily just the socioeconomic scale. You're generally joining a medical scheme specifically to fund a chronic condition.
Right.
So the sicker in society who are able to afford it do make that decision and do make that a priority, because obviously your turnaround times are much quicker in the private sector than they are in the public sector. So the big risk that we have at the moment is if you take the large portion of our patients who are on medical aid and you now shove them back into the public sector, we're going to have a really, as it is, we've got an overburdened healthcare system which is on the verge of collapse. And that was prior to COVID.
Wow.
Now we're dealing with COVID. COVID-19, and we've got obviously a whole bunch of very stressed resource, we've got minimal resources to fight the pandemic, and now add a whole bunch of very expensive rare disease patients to the mix.
Wow.
It's going to be a catastrophe, to say the least.
It's interesting that you mentioned that social distancing is kind of a part of the daily routine of a rare disease patient. So there isn't really much that has changed in terms of your life, and it's kind of as though the entire population now is behaving as though rare disease patients have been behaving for a number of years. Do you think this is in a way destigmatizing how rare disease patients integrate into society?
That's 100% the correct way to phrase it. I can give you an example. We have actually one of the ladies that works in our office who is a chronic rare disease patient. Often she's been immune compromised more times than she cares to remember because of the medication she's on. She's been on severe immunosuppressants for years, and very often during flu season, etc., she will make wearing her bog mask a part of her routine whenever she goes out into public.
Yeah.
And about 2 years ago, she actually wrote a blog on how she had been publicly shamed and laughed at in the queue at the pharmacy of all places.
Wow.
By a mother and her daughter that were standing behind her, ridiculing her, saying, well, what does she think? She's some superhero running around with her mask. And it was, so Megan wrote a blog about it, and somebody actually in the last week, a member of the public reshared that, and it landed up coming back to us saying, if anything now, she's made fashion history because now it's all the rage. And I think for her, it's such a profound moment when all of a sudden the penny drops for someone who was really naive in terms of what patients battle with on a day-to-day basis, to actually realize, sometimes what you look like is immaterial in comparison to what you're trying to achieve. So wearing your mask, yes, it's not the most attractive, it's not the most attractive fashion accessory, but it serves a very real purpose in terms of preventing infection.
Yeah.
So it has, the destigmatization is definitely there.
That's interesting. I'm hoping that it will have a lasting effect in society, in the sense that it would kind of become routine in the future. There's something else that you've also mentioned, which is the response of the private sector and medical schemes. COVID-19 has an economic impact, of course. People are losing their jobs. Are private medical schemes in South Africa, how are they responding? Are they just denying benefits to patients? Are they extending them? Generally, what are the general contours around medical scheme activity?
I'd like to say that they had approached it with compassion and grace, but unfortunately business is business, and it's been made very apparent that it is no different here.
Okay.
So I think from an insurance perspective, obviously insurance across the board, including life-term, long-term insurance and stuff as well, there's obviously a bit of a technicality with regards to continuing cover in the absence of premiums, because obviously the premiums support those payouts, and we understand all of that. But in the South African context, we have approximately 16 billion rand sitting in medical aid reserves. So for each medical scheme, they have a liquidity ratio that they have to, a threshold that they have to maintain, which is 25%. So every scheme takes 25% of every premium and puts it aside for a rainy day. Now, my question has been for the last month and a half, is this not considered a rainy day? Technically speaking, those funds are not held by the scheme. All the schemes are non-profit organizations. And as a result, all the members technically have a right to those funds because it is essentially their contribution that has built up that reserve.
Makes sense.
And the response that I received was, no, not really. So they have put some alternatives in place. They've provided a medical savings account. Anyone who has a positive medical savings balance is allowed to apply to have that medical savings balance used to pay their premium. But it's selection bias, because essentially speaking, the chronic patients and the sickest of the sick don't have a medical savings balance at this time of the year.
Absolutely.
We're halfway through the year. It's the 5th month. We generally use up those benefits by February.
Yeah.
So that's really not a workable solution. And the other alternative was you can take a payment holiday for 3 months, but during that time you won't have cover. So again, what happens to the patients in those 3 months? Do they revert back to the public sector? And what happens if they just stop their treatments and they're now destabilized? So you've got patients who have been relatively stable and well controlled, who are now all of a sudden regressing at a rapid rate into remission. And now you're sitting in a situation where they've relapsed to the point that they're requiring further hospitalization and acute care. Where does that cost get picked up? Surely it cannot be to the benefit of our government systems to allow that to happen.
Absolutely. So how many days or weeks has South Africa been in lockdown?
So we are now out of our stage 5 lockdown, and someone likened the stage that we're in now as stage 5 lockdown in running shorts. And that's essentially what it is, because the only difference is essentially that we're allowed to exercise between 6 and 9 in the morning. Other than that, everything, and they have opened up home deliveries for food.
Okay.
Other than that, everything remains. We are all still relatively isolated. They have opened up certain sectors of the economy, but it's very, very minimal. At this stage, I think there's only about 2.5 million South Africans that are considered essential enough to be working at this time.
Okay, so the essential workers, the essential services. So the longer this lockdown progresses, the increase in risk in folks losing their jobs, losing their private medical scheme cover, being dumped onto the public sector, or potentially having to pay out of pocket, which would be an astronomical cost to cover not only their current healthcare requirements, but then also potentially the risk of contracting or being infected by COVID-19.
Exactly. And I think also, something that's important to remember is that unfortunately, we don't have a stimulus package in place at the moment. It's not as though we've managed to go find new money to treat the existing pandemic. What we've done is divert the funding that we did already have. So the health budget, essentially, which was a very small pie with a lot of people trying to eat from it, has now essentially the slice of the pie has been halved or quartered. So things like disability and genetic disorders, rare diseases, etc., they're going to fall off the wayside. And all the advocacy work that's been done over the last 20 years in this country is going to have essentially gone backwards.
In prior conversations, jumping onto a slightly different track, is Rare Diseases South Africa has grown substantially over the years, thanks to your leadership and all your energy and your efforts. But you've also facilitated an alliance collaboration amongst other NPOs. Would you mind describing for the benefit of the listeners the nature of that alliance and your current activities?
So we've always, as we've realized very, very early on, the HIV and TB sort of sector in South Africa was kind of responsible for a lot of health activism right in the beginning of the day. And I think that undid a lot of the advocacy work that needed to be done going forward, because I think government was automatically put on the back foot as a result of that. And there was this real reluctance to work with healthcare NGOs under the fear that we would be picketing and, protesting outside their offices. So it's taken a really long time to reignite the understanding of advocacy and the fact that it's working together to create change. It's not criticizing the problems that are there. Those problems exist whether we like it or not. To sit and criticize how they happened gets no one anywhere. So rather to find pragmatic solutions collectively that are workable, that everybody can work towards. So we realized early in the day that we needed to align ourselves with various other healthcare NGOs that were working on similar problems in a similar way. So over the years, we've developed a relatively strong alliance, but through this economic impact now, unfortunately, our government's kind of left us in the cold, and there's been no assurances with regards to how NGOs will be funded. We've had no fiscal support being offered. there's been a war room that's been created for every other industry that's known to South Africa, except the NGO sector. So now we started a coalition, if I can call it that, a bit of a collaboration in the last couple of weeks, where we've just started reaching out to other NPOs across the board, from child trafficking to orphanages to animal shelters.
Wow.
And we're all in the same problem. So we're hoping that collective unity will really change the way that the NPO sector is viewed in this country. Whether or not it will, I don't know, but we can only live in hope.
Is it mostly a funding issue, or is it kind of recognition of the role of civil society NPOs in what you're currently doing?
So I think it's a bit of both. I think civil society is generally deemed to be, like I said, the large HIV, TB organizations, and the traditional healers, etc. So that's deemed to be civil society. NPOs are considered 5 or 6 rungs below that.
Yeah.
And essentially, we are the heartbeat of our country. It's the small NGOs on the ground that are out there serving the community on the ground, grassroots level. And it's not about, sure, funding is going to be an issue. We have essentially lost our ability to fundraise in the conventional sense due to the fact that there's no events. But aside that, our economy has plummeted, and it's not looking going forward.
Yeah.
But also just to know that government sees and recognizes the work, and to use us where necessary. Don't reinvent the wheel. We've got options to a lot of the healthcare problems that we're facing. We've got the hands, we've got the staff, we've got the expertise. Harness that energy, use it to benefit what government's needing to do at the moment.
In practical terms, what could such an alliance or collaboration do of NGOs? Are there specific activities that you're currently focusing on?
So as an example, we've got a lot of cancer organizations, and they've had a lot of mammogram and prostate cancer screening trucks that used to go around the country that have now been rediverted into doing COVID screening.
Okay.
And there's a prime example of how you can take existing infrastructure, and with a simple tweak, you can divert it into where it's needed to be. As a collective group, we are obviously focusing on the disparities that we are seeing, and making sure, I can give you an example, as a rare disease patient, we've had lots of treatments that have now been deferred simply because of the fact that the commercial airlines, which are generally how those cold chain drugs get into our country, have ceased.
Wow.
So now we don't have any commercial airlines coming in. As a result of that, we've got none of that stock coming in, and patients are now being deferred their treatments because there's simply no stock in the country.
Wow.
So there's an example where we can highlight that issue with government and say, right, we need to come up with a workable solution. What can we do? Where are flights coming to in Africa, and what can we do to get much needed medication from those centers into the country? We can't rely on ships and cargo, unfortunately. It's just not the way it works.
It's going to take too long. Yeah,
Exactly. So there's a lot of collaborative, issues, and obviously just making sure that the most vulnerable get access to the support and services that they need during this time.
That's a fantastic initiative, and I can imagine that as you start getting more and more people involved in the total coalition, those numbers are going to start adding up after a while. It's not really a business per se, but it's a form of collaboration, and as soon as you start building critical mass, it's kind of comparable to other areas within the economy, right?
Well, exactly. I mean, the NPO sector, and there's 230,000 odd NPOs that are formally registered with our Department of Social Development.
Wow.
On average, they employ 4 people each. Huh. That is more than the mining sector from an employee-based perspective in this country.
Oh, gosh.
So, and yet, the mining sector has been given tons of support, and we're still sitting going, hi, we're still here. So it's not to say that we're used to having the begging bowl out. We know what that's like. That's our world. So it's not, this is not just a funding thing, but it's understanding that as a sector, we provide a valuable contribution to our economic growth in this country.
Absolutely.
We allow people to eat. We allow people to function. We allow disabilities people with disabilities to get back into the workplace. We help educate children. And to ignore the fact that we exist or the work that we are doing happens
Yeah.
is essentially ignoring the vulnerable communities that we serve.
Well, just looking at the numbers that you mentioned, 250,000 employing 4 people. That's 1 million people in total. South Africa's population is, I think, is it 52, 53 million, 55, somewhere around there?
55, yeah.
55. That's a large chunk. And in best case scenarios, this 1 million people activities and the value that they're adding in society should be funded out of tax revenues. But that's not the case, right?
So there's very minimal tax relief that is offered to people who support NPOs. We've probably managed to get by on what it was for a while, but now, obviously, our country has launched the Solidarity Fund,
Yep.
which is a great, and I think many countries around the world, it's a global initiative. But the companies have been encouraged by further tax relief in donating to the Solidarity Fund, which essentially cuts us off at the knees even further. So now we're not only fighting, you're trying to put your cause in front of a donor saying, please don't donate to Solidarity, still continue to donate to us. And then you're having to justify why they must lose half the benefit in donating
Wow.
to us over donating to the bigger fund. And that's essentially, that's some of the things that I feel that government, if you want to provide tax relief for donations, do it across the board. Don't be specific on who benefits and who doesn't.
Yeah, absolutely. You mentioned also a little bit earlier on medicine shortages, supply shortages, flights coming into Johannesburg, Cape Town, Durban, depending on the city, but the distribution. Are you finding that there's been an escalation in the shortages? And are there any proposed solutions from that, either from the regulator or from within the private sector?
So I can tell you from our perspective as Rare Diseases South Africa, we have started our own stockout reporting.
Wow.
Simply because the reporting that was offered previously is not really functional anymore, and we could see this becoming a massive problematic issue. So we've left the responsibility on patients to notify us of the fact, simply because you can't rely on anybody else in the supply chain to do it at the moment because everyone's so overworked and resources are just scarce.
Yeah.
So we're relying on the patients to let us know that they're having a problem, and then we are escalating it as an organization with only 9 people in our office.
Wow.
So I mean, it's a big task, but we've been successful in navigating where there have been shortages, in navigating workarounds around that.
Got it. And this is a service currently available on your webpage where patients submit their details and then you update that database, right?
Correct.
Okay.
So as they've submitted it, it comes through to our inbox, and then we escalate it with the various, either the pharmaceutical company or whoever it was that manufactures it. We look for an alternative. If there's no way of getting that in place, contact the healthcare professional, make sure that they are happy to script an alternative if there is one that's locally available. So it's a bit of a nightmare, and these are the sorts of activities that NGOs are chomping at the bit to do. We're going above and beyond our normal call of duty, so to speak, to assist patients more so in light of this pandemic, and really not receiving any assistance whatsoever.
So the webpage that it's been coordinated through, which webpage is it?
It's that particular link is rarediseases.co.za/stockout.
Okay, we'll include it in the description of the video as soon as this is posted and made available online. Something else that I also wanted to touch upon is that accessing healthcare services, COVID-19 lockdown, we're all in confinement, but there's healthcare needs of patients with prior conditions, current conditions. Have you experienced any challenges or barriers to obtaining current healthcare services in the context of what we're facing right now?
Yes, actually, we sent out a survey in conjunction with Rare Barometers, which is the Rare Diseases International sort of research center, and 48% of our patients have stated that they have had a complete abruption of services.
Wow.
So either their regular hospitalizations, their treatments, their therapies, be it rehabilitation, speech therapy, etc., have ceased. And I mean, and also one of the challenges there is there's no resumption date. It hasn't been like, look,
Yeah.
we for the period of lockdown, we can't service you, but as soon as lockdown's finished, you can come back. It was kind of a case of, don't call us, we'll call you. We'll let you know when we can see you again.
Got
So
it.
the anxiety component around that for a patient who's already battling a chronic condition is dealing with a lot already from having to live with that disease.
Well,
Now with the added anxiety of not knowing where your next treatment's going to be, you having higher thresholds of pain, um, those things, you've got limited mobility, you're dealing with the isolation and lack of immediate support in terms of friends and family.
yeah.
It really is a lot to deal with.
I can imagine. So medicine stockouts on one end, inability to reach your treating physician on another end, and then just the psychological effects of confinement is
And
another
the,
domain.
and the lack of data specifically
Uh-huh.
to, so obviously because of the fact that our rare conditions are that rare, there isn't a lot of data around comorbidities and picking up with COVID. So
Okay.
we've seen a lot of stuff coming through with regards to diabetes and cardiac and pulmonary conditions. But, as an example, as a lupus patient or as a rheumatoid arthritis patient, you're not sure how it will impact you, someone with an autoimmune deficiency, etc. You're not sure what would happen in the event that you get COVID. How would it impact you? What's the best approach, particularly for your condition? Because there simply isn't enough information out there,
Yeah. Yeah. Got it. And the
which
immune.
is ironic given
It
the
is.
information overload that we're currently all experiencing.
It's paradoxical that we're facing this information overload. It just highlights our dependence on the internet. The last thing that we need as humanity is a meteor shower to knock out our global telecommunications system and electricity grids. Then we'll be suddenly catapulted into the dark ages,
Absolutely.
literally. Kelly, I wanted to ask one last question before we wrap up, which is if if patients aren't accessing their healthcare professionals, doesn't this suggest that there's some spare capacity in the healthcare system if healthcare professionals are kind of sitting at home or sitting in their practices idle? Couldn't these be used in a better way?
So I've seen a ton of mails and surveys, etc., coming through from particularly a lot of doctors in the private sector whose waiting rooms are essentially empty. You've got all the elective surgeries have been postponed. You're
Yeah.
not, due to the fact that there's a limitation on movement, freak accidents, car accidents, alcohol abuse, etc. Those sort of casualties have all but dried up at the moment. So, emergency rooms are empty. So absolutely, there is a lot of capacity. And yet we've gone and employed I think 240 Cuban doctors to come into this country
Wow.
for the next year to assist with the pandemic. Sure, maybe 6 months from now, 3 months from now, that would have been necessary.
Yeah.
But right now, you've got a fair amount of well-qualified, highly educated and specialized doctors who haven't had patients to treat.
And they're currently not working, right? Well, very little demand for their services, and that's essentially
Absolutely.
capacity that could be redirected. 400 million sounds like quite a lot, but you really haven't looked at those numbers and how much the Cuban health authorities are charging for it. Kelly, to wrap up, I want to give you the final word. Any thoughts and suggestions that you think listeners should consider going forward in how they think about rare diseases, COVID-19, patients and patient organizations?
I think in terms of patient organizations, if ever you have had the need to or have previously supported patient organizations, now's the time to reignite that support, because I can tell you now we're all going to need it and we do valuable work. And in terms of being a rare disease patient, obviously try and minimize your anxiety as much as possible. Connect where possible to make sure that you kept your mind strong, because essentially a weak mind is a really big issue in these sorts of times.
Yeah.
And then I just think, from a human to human perspective, have a little bit of understanding. We're all frustrated, and be responsible. I
Yeah.
think at the moment our government is essentially, by moving us to stage 4, they're giving us rope, and it's up to us as fellow citizens as to whether we're going to hang ourselves with it or not. So be responsible, wash your hands, wear your masks, do your little bit, and hopefully if everyone does their own little bits, together we can make a lot of change.
That's a good point to end. Kelly, thanks so much for your time, and appreciate you connecting and sharing your views today with the listeners.
Thank you very much for having me.
You're most welcome, and please continue with the great work. Thanks everyone for connecting. Appreciate your time. If you'd like to be notified of future webinars, please be sure to drop us an email or give us a call. We'd be happy to connect with you. Thanks so much again.